Each state of the United States has its own distinctions of landscape and character. Knowledge of one of them, New York, say, or California, would give you no real clue to the rest of them. When I first came to Kentucky, I was struck by the neat green fields and the handsome horses, the breeding and racing stock for which the state is known to sportsmen. One day, I think, this part of the world, Kentucky and its neighboring states in the southeast, may be better known for something else. It was one of the first American regions to acknowledge that women had the right to limit their own fertility. The attention of concerned persons was first drawn to women in the barren coal mining and timbering counties, far from these gentle hills, trying to cope with isolation and poverty, and too often, too many babies. By concerning themselves with the health and the destiny of these women, they became pioneers in the struggle to make family planning legal and generally available. I want you to know some of the people with whom I have worked in the years since I left private practice in Cuba to become first a health officer and finally director of maternal and child health for the state of Kentucky. This is a story of people. But first, I want to show you a place, a clinic, which occupies part of a factory at the edge of an industrial town. A public-spirited factory organization saw the need for a family planning clinic in a crowded industrial neighborhood and decided to remodel a section of its own property for that purpose. What we were able to create in this cooperative venture between the public and private sector was not merely another clinic, though that would have been good in itself, but a clinic with special character, devoted to the principle that every patient is an important individual, deserving of concern, respect, and a genuine interest in his or her problems.
You'll go with Charlene now. She'll take you back to the interview room and get you started. Okay, thank you.
We found very early in our work that the treatment a woman receives in a family planning clinic strongly affects her continuation rate and indeed her whole relationship to the principle of family planning.
I see it's time for your yearly again.
The clinic is so constructed that there are private cubicles for all interviews and examinations.
Now, is your husband still a taxi driver?
Yes.
And are you still a babysitter?
I only do that part-time.
Okay. Is your income still approximately $105 a week?
Yeah.
Okay. And you haven't been pregnant since you were here last?
Since last year, no.
Okay. When you need a doctor, do you still go to Dr. Longshore?
Yes.
Okay.
You can change in here, Mary. You can put your clothes on the hook on the wall. Here's your gown. When you're finished dressing, walk through the door to the examining room. If you need
The
me...
principle of privacy, so often overlooked in public clinics, is respected at every stage. After an unsatisfactory trial, Mary has had her IUD removed and, in agreement with the doctor, will begin an alternative method of contraception.
I will indicate the pill on the chart. The nurse will tell you how to take it, and then she'll give you pills for your next few months. Do you have any questions?
Well, how long do you have to take these pills before they're effective?
Usually 1 month before they're completely effective. Occasionally, in an emergency, you can take them for 2 weeks, and you'll be safe.
All right, Mary, these are the pills that have been ordered for you. You're going to start on the 5th day of your period taking your pills. That means if you have a menstrual period that begins on Monday, you'll start counting with Monday and count 5 days. That would mean on Friday you're going to start taking your pills. Write Friday in right here so you'll always know where you are. You punch your pill out through the back. If you take your first one Friday, you will take this one Saturday and this one Sunday and so on all the way across. Now you will take 1 pill a day, the same time every day. You will take all the pink ones first and then all the green ones. You should have a period somewhere on these green ones. As soon as the last green one is gone, you're going to start a new cycle of pills, and you will always start up here. The green ones have nothing to do with birth control. They're simply to keep you in the habit of taking your pills every day. But it's very important that you take them.
Take all of them?
Take every green one, no matter if your period lasts 2 days or 7. Now, do you have any questions about that?
What do you do if you forget to take a pill one day?
In the first place, try very hard not to forget to take a pill. If you take the same time every day, you won't be so apt to forget. If you do forget to take a pill, take it the next day as soon as you remember it. Take your regular pill at the regular time. If you miss 2 pills in one cycle consecutively, don't plan on being protected. Now, when you come back to us, we'll check your blood pressure and your weight. Next time, we'll most likely give you a 5-month.
It is especially these girls, not long past adolescence, who profit most by the professional attention available in a family planning clinic. This is one of our maternal child health clinics in Appalachia, the remote and hilly region of central Kentucky, which was once so inaccessible to professional medical services. Now, young women from this entire region come here to receive on a regular basis comprehensive health care, including guidance in family planning and contraceptive supplies.
Geraldine, you want to step over here and let's get your height and weight. That's it. I want to mess up your pretty hairdo. She's 64 and a fourth. $123 and a half.
Are you tender there when I touch you, dear?
Dr. Louise Hutchins, a family planning veteran of profound experience, began her medical career in China, where she was born. For more than 3 decades, she has offered professional service to the people of Kentucky's rural mountain areas. Having functioned in virtually every healthcare capacity, Dr. Hutchins now sees patients as part of a mobile team.
Now, I may not do this exactly like the other doctor did, and we put a little pricker on you, dear, and then there'll be a little full.
She visits this clinic twice a month, treating her clients as though they were young relatives held in affectionate regard, gently dispelling their fears and their discomforts.
I guess we better use a D since she expelled her other one. Take a big breath, hon.
Watching her insert an IUD is a miniature lesson in doctor-patient relationship. It is a clue to why her family planning efforts in Appalachia have been so successful.
The children all well? Yes. Uh-huh. That's good. And you know, we'll expect you to wait for 15 minutes afterward. And do you have a watch on, dear?
No.
Well, it'll be about 25 of by the clock outside then. And you don't have to stay here, you know. You can go out and be with the kids. And then we'll want you to come back and knock on the door and tell us how you're feeling before you go. Do you have anybody to drive home with you?
Yes.
That's good. And you won't do a lot of heavy lifting this afternoon either, will you?
No.
Good. I'll just feel it. When I returned from China after my internship in 1939, I became interested in the fact that the mountain women had 12 children but had no knowledge of contraception. So from 1939, I've been involved in family planning and how we could best get it into the mountain rural areas. I applied for work with public health and with family planning, and they suggested that I might want to be the clinician for a family planning mobile team, which I accepted immediately. Since then, we have seen 15,000 women, inserted over 1,600 IUDs. We see about 5,000 women a year. We're now visiting in 16 mountain counties, 10 of them once a month and 6 of them twice a month. In 1967, I went to Hong Kong with my husband and for 3 years worked in the Hong Kong Family Planning Clinics, which are a part of the International Planned Parenthood Federation. While we were in Hong Kong, it was a very simple matter because we're in the heart of a tremendously crowded city where there might be one block of buildings with 5,000 women, and they could walk to almost any of the 50 clinics in Hong Kong with their babies on their backs and by their hands and get their supplies. But in the rural areas, you have a real problem. We even have women now who hitchhike barefoot to the clinics, and many of them who have trouble getting in to get their pills, husbands may not be able to come in and get them. So that we find this team, which goes to each mountain county, has been a really wonderful thing. We have many, many more young brides than we did in Hong Kong. The tendency was to marry late, in the late 20s. And my first case here was a 23-year-old with 5 children, in which I inserted an IUD. She'd had twins and she'd had thrombophlebitis.
Laborers in the vineyards such as Louise Hutchins and myself have participated in fertilizing and seeding the special area of healthcare known as family planning. But for the long haul, the work will have to be done by the young people who have spent all their lives here. They can surmount barriers which would be impossible to an outsider and can communicate within their own childbearing generation. Such a one is Martha Blair, a girl of this region, wife and mother, a person of unusual compatibility with her job, her colleagues, her clients. She takes family planning so utterly for granted that literally anyone can discuss it with her without hesitation. Her attitude is an exercise in the virtues of still another approach, not the beautifully motherly bedside manner of Louise Hutchins, but the matter-of-fact candor of a contemporary country girl who can talk about family planning in all its forms with healthy common sense and good humor.
Now you see here a picture of the brain, and maybe you hadn't thought about it before, but the brain is involved with birth control because your brain sends impulses to your reproductive organs down here by way of little things we call hormones. So this is the reason for the picture here with the brain in connection with the reproductive organs down here. The method of birth control that you choose is an individual decision made in conjunction with your physician. I personally feel it's good to discuss this with your husband, but your husband really cannot control whether you use birth control or not. This is a decision of your own because there's no law that says that he has to sign a paper saying you can use birth control, with the exception of being sterilized, which we'll talk about a little later on. A vasectomy is simply an operation that would prevent you from getting a woman pregnant in most cases. In fact, we have to consider this an irreversible procedure, even though procedures have been done that render the man fertile again.
Are you saying that it's not really a 100% safe method? Is there still a possibility that I could get my wife pregnant after having had a vasectomy?
Okay, this is one of the surest methods that you can choose. However, there have been reports that very, very, very rarely that a man would become fertile again. One of the biggest things that I would like to stress at this point regarding that is that you return for your sperm counts as the surgeon will instruct you, because until they've done a sperm count, they're not really sure that you're sterile, and some men make the mistake of not returning for the number of sperm counts recommended.
I understand that this might cause some hang-ups or problems, some mental hang-ups in sexual relations with your wife and all.
I'm glad you asked that question, and I'm especially pleased that you feel free about mentioning this. So many times men have questions that relate to this area of vasectomy, but they're reluctant to ask them. If you look in this picture, you can see here that the only part that's involved with the surgery itself is this one tube called the vas deferens, and this is tied off and cut. However, I think what you're asking is, when you have relations with your wife, will there still be fluid and all? So the semen itself is collected from different organs, as you can see here. So the only thing that will be missing is that there will be no sperm in the semen. But as far as the ejaculation and the fluid, then there will be no change in that.
Hello, Lillian. Oh, hi. Come on in and sit down.
We've been missing you at the Family Planning Clinic.
Well, you know how they used to come get us in the Scout, the state, Well, since they cut that out, I just don't have a way to go.
Have you quit taking your pills completely, or did you get them somewhere else?
Well, I had a headache real bad last week, and I went to the doctor, and he told me go off the pills, just forget about taking them, so.
Oh, I see. Did he explain that there are other methods you could use?
No, he just didn't. He just told me to quit taking the pill.
I'll tell you what, Lillian, I'm going to give you an appointment for next Thursday at 12:30. And Mrs. Cornett, just down the road here, has an appointment that same day. Would she mind if you rode into clinic with her?
No, I'll come in with her.
Okay. Now, you be sure, Lillian, and keep the appointment, because if you keep waiting to come to clinic, you're going to end up pregnant again.
And I sure don't want to get pregnant.
Before I start the lecture, if I could take just a minute to explain to you what I'm doing here, I think maybe you would have more of an understanding of the importance of my being here. I am a nurse, but this particular part of my work is not connected with my job as such. However, the work that I do is with pregnant women and babies, and many of our girls that come to our clinic are unwed.
Martha can talk to men at a training camp as easily as she talks to girls her own age.
See the women, the man's gone to work or he's nowhere around, so we really kind of have been leaving the man out of the picture, which, as far as I'm concerned, is bad, since any pregnancy, a man is around somewhere, so he has some responsibility in the planning for children, too. So I'm going to go ahead and talk about family planning or birth control, but I'm going to gear most of my remarks to the man's role. Now, condoms are coming back more than they were, and they're more popular and they're more colorful. So this is, I think, added to the popularity of condoms. So I'll leave these up here if you want to look at them closer after the program. However, you just have to be sure when you're using a condom that you understand how to use it correctly. And I know some of you think you probably know more about that than I do, and perhaps you do. Some of the things I'd like you to think about that are important in planning a family are like your finances. And I'm not saying because you're poor you shouldn't have a child. But I think you do have to think about this because of the cost that's involved, not just with delivery, hospitalization, this sort of thing, but in raising a child is where the big cost comes in. I think you need to know if you're ready to settle down to the responsibility.
If this kind of no-nonsense approach to family planning had been taken long ago, particularly by members of the health community, I think it would be a more nearly universal concept than it is today. Martha carries her almost apostolic mission to make family planning better known into many byways. She gives regular talks on the local radio station. She believes with all her heart in education as the foundation for success. If education takes such unusual forms as appealing directly to parents of retarded children to recognize that their children have sexual identity, so much the better.
And today I would like to briefly explore with you the topic of love, sex, and birth control for the mentally retarded. It is unrealistic to believe that retarded
She reminds them that for those children to become parents would be a preventable tragedy.
And from anybody who will talk about it. Usually their classmates and playmates don't know any more about sex than they do. All children have a natural, healthy curiosity about sex, but they often find that adults won't talk about it.
When she talks to the people out in the once forgotten hills, she talks as one of their own. She carries the message that they and their families are of deep concern to all those who perform health functions for the state. She expresses our binding belief that without planned families, we cannot even begin to think of total health, the physical, mental, emotional, social well-being of the individual. It is a message we are pledged to repeat until all who need it have been reached.